Hi, my name is Dr. Leigh Vanderloo, and I'm currently the Knowledge Translation Manager at Participaction. For those of you that don't know, Participaction is a nonprofit organization located in Toronto, Ontario, and our main goal is really to help support active movement for all Canadians of different ages, abilities, and genders, and really trying to find creative ways that we can add a little bit more movement into our day-to-day lives. Find ways to minimize how much time we're spending being sedentary and really ensuring that we're finding ways to translate or mobilize whatever is the best current available evidence into the hands of the organizations or the people that are best able to do something with it. In terms of my background, I completed my PhD at Western in health promotion and focusing on pediatric exercise science. And over the last few years, I've been really looking at ways to examine not only how do we get Canadians more active, how do we get them moving, how do we appropriately measure and really reflect how much movement we're getting in throughout our day, but also looking at the environment in which this activity takes place. So while we do have these ideal guidelines that we want to strive for, we have to ensure that the environments are conducive to do so. If we're constantly working against the grain and are constantly being met by barriers, it's going to be really hard for us to engage in those healthier behavior changes or to stay motivated or to have those supports in place. And so a lot of the work that I've been doing and with Participaction is to examine some of those barriers. How can we find ways to help support Canadians or the organizations that work with Canadians to help find ways to make the healthy choice the easy choice. And so that's kind of what I've been striving to endeavor to accomplish in my last few years at Participaction, and to really ensure that we're translating the best available evidence so that everyone is actually able to act on it and feel empowered to make some health decisions. We always think that we should get active to lose weight or to prevent weight gain, when in fact we should really be thinking about all the actual benefits that are going to come either immediately or after this extended use, well beyond what it's going to do for our waistlines. And so, if we think of these acute as that, most people don't know, or that it's just slowly starting to become a little bit more aware, is the benefits that physical activity has on your overall brain health. And so when I talk about brain health, it's not just our cognitive health, so the way that we think, learn, process, and retain information, but it's also in terms of our mental health. So our resiliency, our stress reactivity, how we're able to either combat or to help manage symptoms of depression and anxiety. And those are huge areas that, the research is really just exploding in this. We've seen most of it come out in the adult literature, and we're starting to see a lot more descend down into the younger age groups in adolescence and in childhood. And, it's quite profound. After just a single bout of physical activity, we're going to see improvements in how well we're able to focus, process information, and also help decrease the amount of cortisol circulating in our body, which is our body's stress hormone. It's going to decrease the amount of adrenaline, and it's going to help give us a healthy boost of some of those neurotransmitters and endorphins. And so I think, when we start thinking about that, is like what a profound impact it can have on that in just a single bout, where, stuff with regards to, weight loss, is that of course we're going to see improvements there, but it's going to be after an extended period and participation. And I think oftentimes that's what deters people from getting active, is because they get on this new regimen. They're doing it, they feel like they're working really hard, they're uncomfortable, they've been doing it for weeks, and they're not really seeing a huge shift on the scale. And that can be really demotivating for people. And it's enough for people to be like, you know what, it's not working, I'm not going to bother. And I think that that's another reason why we shouldn't be promoting physical activity only for that particular benefit. It is going to help you build strong bones and muscles, which is particularly important for women as we age, because we're more at risk for osteoporosis. We really want to ensure we're doing those weight bearing exercises to build up that bone density, which is going to be great as we age. All throughout the lifespan, it's going to ensure that we're able to live a very healthy, active, older adulthood. But also for all the other benefits in terms of preventing chronic disease, which are just becoming quite prevalent in Canada. And so those are those reasons that we really want to focus beyond that. But I think what's most interesting and where we're going to see the biggest bang for our buck is definitely around this brain health. And I don't think we get enough attention there. So, if we look first at the cognitive perspective, so in terms of what it does for our thinking and learning, not only for the students, but for the educators as well, the more you get active um, overall, people, or so students, if you talk about the students, for example, we know that those that are more regularly active tend to perform better on academic assessments. They tend to make less mistakes on testing, for example. They do much better in subjects such as math as well as English. They are more creative thinkers. They're much more productive. They're able to retain and recall information much faster, which is good not only in the classroom, but of course, again, during an assessment or a testing period. They're much better problem solvers, and they're able to focus and concentrate for extended periods of time. So when you think about having the students in your classroom and what does that look like, sometimes it can be very hard, and some students have a trickier time doing it, is staying focused for a very extended period of time while they're sitting. And so trying to find ways to kind of integrate a little bit more movement, even if it's as simple as giving permission for them to stand throughout certain lessons, having standing desks, having 2-minute stretch breaks for every hour of instruction, is a great way to kind of just break up those extended bouts of sitting. It gives them that kind of refresh, that kind of pose before they can go back and continue focusing on the task at hand. Likewise, it's going to be beneficial for the teachers as well. It can be a lot of work having to stand or to give a lesson, and sometimes it can become a little bit rudimentary, where you're kind of just getting to the point where you feel like you're just, regurgitating the lesson plans and giving that. But in terms of really ensuring that you're effectively communicating your information to the students, to ensuring that you're being as productive as you can throughout the workday, because of course your work doesn't end just with when you're communicating your lessons. You have marking, you have lesson planning, and so much other work that goes into that, as well as class management. And so not only is it going to help keep your stress levels down, it's going to help you bounce back much more quickly from stressful situations, but it's also going to help in terms of how you manage your class, and also with the students being active and them having a little bit of a better handle in terms of their emotional regulation, maybe their responses to stressful situations. It's going to make it a lot easier for you to manage the classroom as well, having a class with a little bit more focus and a little bit more attention on the task at hand. So we can see the benefits that it has both for the students as well as the educators, and that's just mostly from the cognitive perspective, but also from the mental health, when we think of stress, emotional regulation, as well as symptoms of depression and anxiety, the prevention of it, or the management of them. Is that when we're active, and particularly at higher intensities, it does actually cause the parts of the brains that are responsible for memory, executive function, as well as decision making. So we're thinking of the frontal lobes, the hippocampus, or the basal ganglia. It actually causes those areas of the brain to actually grow in size. And the way that it does that is that the physical activity causes the brain to release this BDNF, which is just a fancy word for saying miracle grow, essentially, for the brain. And it essentially serves as this protein that's actually going to help those areas of the brain grow. It's going to help build new neural connections, new learning pathways within the brain. And also, by having those bigger areas of the brain, it certainly prevents atrophy. And this is one of the reasons why we know that physical activity and exercise is one of the best things we can do for preventing cognitive decline as we age. Of course, during the normal aging process, we do see those parts of the brain that are responsible for memory, decision making, executive function start to shrink or start to atrophy. And that's typically when we start to see those risks for cognitive decline, dementia, and then in more complex cases, Alzheimer's disease. But the more that we can get active, and that's why oftentimes movement is a part of those treatment plans, is specifically for those reasons. It helps keep those brains much denser, much bigger, more neural connections, and prevents the shrinking. So that's one of the ways that it helps prevent or encourage, better thinking and learning from that perspective. from a mental health perspective, the way that physical activity, and again, any movement is good movement, but the more that we can do it on a regular basis, and particularly if we can get it to this higher intensity where we're breathing a bit harder, we're starting to feel warmer, that's going to give us even more benefits. And at that's what we're seeing, is that it's going to calm your autonomic nervous system. So if we think of our fight or flight response, it's going to help calm that part of the brain. It's going to help decrease the amount of adrenaline and cortisol we have circulating in our body, which is our body's stress hormone, which again is going to help keep us calm. It's going to decrease the heightened reactivity that we have to stressful situations or uncomfortable situations. And then it's also going to help release a burst or surge of either feel good hormones such as endorphins or neurotransmitters such as serotonin and dopamine. And so those things are definitely going to help have an increase of those. They're going to be flooding the brain, and all of those help with mood regulation and are definitely play a really key part in preventing depression or anxiety. Or if you're someone who's already been diagnosed with those, it's definitely going to help further progression of those conditions, or to help be a key way to manage those symptoms.